Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Dr. Joss Reimer, Medical Officer of Health and Medical Lead for Vaccine Implementation Task Force. Today we're announcing 3 additional deaths due to COVID-19, and all were from the Winnipeg Health Region. I'd like to extend my condolences to the family, the friends, the caregivers of these individuals. There is a death correction noted on the bulletin today. One previously announced death has been removed, bringing the total number of deaths due to COVID-19 to 823. This particular death was in a female in her 80s from the Interlake Health region, and it was announced on Thursday. It was determined that this death was not related to COVID-19. And so by providing very frequent updates on our numbers, including deaths. We'll often go back and we continue to review these numbers to ensure that the cause of death was actually COVID. And from time to time, we will find cases like this that after further review, we'll determine that it was not related to COVID-19 and then can update Manitobans as needed. Current 5-day test positivity rate is 7.5% provincially and 4.9% in Winnipeg. 157 new cases of virus have been identified as of 9:30 a.m. today. Total lab confirmed cases in Manitoba is 29,280. This morning at 12 a.m. new travel restrictions went into place. The public health orders were amended to implement formal restrictions on interprovincial travel. And this is to help protect the importation of the virus into the province, especially the variants of concern that we've seen internationally and now in many parts of Canada. And so our advice has remained, and obviously will continue to remain, that Manitobans should not be traveling, whether this is internationally or interprovincially or even within our province, except for essential purposes. Not traveling will reduce the impact of COVID-19 by reducing the likelihood of further importations of this virus, and again, further limitations of the importing of the variants of concern. We haven't detected any of the variants of concern in Manitoba as of yet. We want to have these preventive measures in place to further prevent that. We are testing regularly for these variants and have yet to discover. These revised orders formalizes the measures and lays out clear requirements for Manitobans. Again, we all need to work together to try to bring down these numbers and keep them down. If we limit the amount of importation of this virus and we continue to work on bringing the numbers down that are in our province right now, this is going to help us again start to reopen things safely. So we'll follow those fundamentals, physical distancing, washing your hands, again, staying home when ill. We repeatedly hear from our case investigators of cases that were discovered only to find out that there was multiple days of exposure because they were out and about with mild symptoms. They didn't think the symptoms were severe enough to be COVID. So again, COVID can have very mild symptoms. So we want anyone with any symptoms, stay home, get tested, do those things even if you're not sure. We need to decrease the amount of contacts that we have. So the public health order related to travel, 14 days of isolation is required for people returning or coming to Manitoba from other jurisdictions. Individuals who traveled internationally or interprovincially must go into self-isolation for 14 days of the date of arrival in Manitoba. We're again strongly advising all of these individuals to go for 2 COVID tests upon arrival. So 1 immediately upon arrival, 1 again at 7 days. And this is regardless of whether they're displaying symptoms or not. There are some exemptions, and they're listed in the orders. But again, the spirit of this is to limit the importation of this virus. So we want to reduce the amount of traveling that occurs, and for those who return, we want to limit the ability for those individuals to spread that virus should they become ill. So like all the orders, we can't address every eventuality, every specific situation. So the spirit of the orders are there. We ask Manitobans to follow the spirit of the orders, which are multiple, and that is to decrease the amount of contacts we have in general. Related to travel, we want to decrease the ability for someone to import the virus. And so that includes limiting travel, and when you do travel, to be in isolation when you return. So we ask Manitobans to work together with us. Let's keep our numbers down. Let's keep the variant out. Follow the spirit of the orders. Don't look for ways to skirt the orders. We need to stay diligent if we want to continue our reopening plans. Our right now, our recommendation is to avoid all travel unless it's essential. So certainly travel to cottages and secondary properties are not encouraged at this point. If the property is outside of Manitoba, you need to be aware that other provinces, other jurisdictions have orders of their own, so you'll be required to follow those if you're outside of our province. And for instance, visitors to Ontario must self-isolate for 14 days upon arrival unless they're going to the property they own for less than 24 hours. And so if you do choose to visit your secondary property or cottage, you should take that leave no trace approach. So drive straight to your property without making any stops or visits along the way. Stay at the property for the duration of your visit and not interact or visit with people outside your household. So the intent here is not to travel to a cottage and then again have multiple interactions with multiple households. If the orders in that province aren't followed while you're there, then you are required to self-isolate upon return. And so it remains crucial we continue to follow the orders that are currently in place and those fundamentals so we can keep these numbers down. If a person at home, again, is ill and waiting for test results, the entire household should be self-isolating. And again, that's even mild symptoms. Don't take any chances. If you have mild symptoms, get tested, stay home. Before I pass it over to Dr. Reimer, I wanted to have another Fast Pass update. Individuals working in licensed child care centers, nursery schools, family, group child care homes within the city of Winnipeg, Hanover, and the Seine River School Division boundaries will soon be able to access an appointment for COVID-19 testing at the Fast Pass site at 1066 Nairn Avenue in Winnipeg. Fast Pass clinics are able to access a positive result on the same day of receiving a test to enable faster contact tracing and earlier notifications. Eligible individuals can be tested if they are symptomatic, have been identified as a close contact as a result of an exposure at school or childcare setting, or who have a symptomatic household member. And again, this applies to mild symptoms. Appointments for the pilot site will be open to eligible childcare providers effective February 1 and can be made online. So thanks, and I'll pass it over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, the medical lead for the Vaccine Implementation Task Force. Earlier this morning, I was able to join one of our focused immunization teams at Meadowood Manor, where they were immunizing eligible residents. I just want to take a moment to say how incredibly impressed I was with the work of the team there, both the focused immunization team members as well as the workers at the personal care home who participated in this morning's immunization. It really stood out to me in particular, the joy that people were experiencing around receiving those vaccines. Everybody that I offered an immunization to, when they left the room, the staff at the facility literally broke out into applause and cheering for every single person that left the room. And it's one of the most heartwarming experiences I've had during this pandemic. So to just see the staff who are genuinely excited for the well-being of their residents and the excitement on the faces of the residents was something that, I'm so honored to have been able to be a part of today. Our PCHs, the residents at our PCHs are a very vulnerable population, and that's why they've been one of our top priorities for immunization. By the end of tomorrow, our teams will have visited every single personal care home in the province to deliver the first dose of the vaccine to eligible consenting residents. We did this in 3 weeks, which was fully 1 week ahead of schedule, and that is due to the partnership and support we had from all of the teams, from the regional health authorities, from the personal care home sites. So just, please accept my huge thank you to everyone who's involved in this incredible effort. Nous avons achevé cette étape de notre plan de vaccination en 3 semaines, avec 1 semaine d'avance sur notre calendrier. Nous avons réussi ce tour de force grâce à la collaboration et l'aide de toutes les équipes des offices régionaux de la santé et des foyers de soins personnels. Merci à tous ceux qui ont participé à ce effort incroyable. Until they can return to personal care homes to administer second doses, the focused immunization teams will now be targeting other high-risk congregate living settings, such as long-stay hospital patients and supportive housing facilities. Next week, for example, they'll be visiting the Manitoba Developmental Centre, the Vita and District Health Centre, and Gladstone Health Centre. So as I've said before, our approach to immunization is simple. We are focused on safety and not speed. We continue to see that our planning is providing results. As of this morning, we have administered over 29,000 first doses and almost 6,000 second doses of the vaccine. That second dose is critical because it provides much fuller protection against the virus, particularly for our residents of personal care homes. Because of how we manage the vaccine rollout, Manitoba is now second in the country, only behind Prince Edward Island in the per capita number of people who have received both doses of the vaccine. Grâce à la façon dont il a géré le déploiement de sa campagne de vaccination, le Manitoba arrive maintenant au 2e rang du pays, derrière l'île du Prince-Édouard, pour la proportion de sa population ayant reçu les 2 doses de vaccin. This is our plan, and we will continue to make sure that we fully protect as many Manitobans as possible as soon as we have the necessary supply of vaccine. On Wednesday, Minister Stephenson and I provided a more detailed look at Manitoba's priority populations for immunization, which sets out how we will get the vaccine to those most at risk of serious outcomes first. If we could immunize every Manitoban today, we would. But the supplies are limited, and as we've clearly seen, they can be unpredictable. So we need to set out a roadmap for this immunization campaign in the weeks and months ahead. I would encourage Manitobans to review our priority populations and many of the other updates that are available on our website at manitoba.ca/vaccine. In the near future, we will also be launching an online calculator so that you can easily see where you fit among those priority populations. I am also very much looking forward to joining my colleague, Dr. Marcia Anderson, on Monday, where the focus will be on the vaccine campaign among First Nation people, priority populations, and how Manitoba is supporting this work. Of course, it hasn't been all good news this week. I've been regularly updating you on the Pfizer supply disruption. And yesterday we received some confirmed shipment details from the federal government. By the end of March, we will be receiving 12,870 fewer doses than we had originally expected. That means we'll be receiving 161,460 doses rather than the original 174,330 doses. In many other places across Canada, the effects of this supply disruption have been significant. Thanks to Manitoba's careful planning, we anticipate it will mean that we will have to reschedule several hundred appointments originally booked for the week of February 15th. That's the bad news. But the good news is that they will only have to be moved by a few days. And we have our whole team working very hard behind the scenes to minimize the number of people who will be affected. Rescheduled appointments will be happening within the week. So every person in Manitoba who has a scheduled second dose appointment will still be able to get it within the recommended window by the manufacturer. I can also confirm that the Pfizer disruption will not affect the final date of completion for our personal care home campaign. It also will not impact the partnership with First Nations to allocate doses, nor the launch of the Thompson site on Monday. And finally, before we go to questions, I just want to take this opportunity to remind Manitobans that Dr. Roussin, Minister Stephenson, and myself are hosting a telephone town hall on Tuesday, February the 2nd at 6:30 in the evening to answer your questions about COVID and about the vaccine. So to register, you can visit engagemb.ca. And with that, we will take your questions.
Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions. Up first this afternoon from the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, do you think public health will now have more room to loosen restrictions with nearly 7,000 personal care home residents having received the first dose of the vaccine?
I'm not going to speculate on what our orders will look like. We're still looking at our orders overall. I think it's fantastic news that the Vaccine Task Force has been able to achieve this ahead of time. We know that our personal care home residents are some of the most vulnerable Manitobans. We've seen that, close to half of our deaths are related to cases in personal care homes. And so I think it's definitely a step forward. What we see is that that doesn't have a large impact on hospitalization rates and has very minimal impact on our ICU rates, which is also a big indicator that we have to follow when we're loosening restrictions. But no doubt it is definitely a great step forward.
Okay, thank you for that. And can you say, Dr. Roussin, on a weekly basis, how many COVID-19 swabs are being screened for variants?
Yeah, and so it's roughly about 5% of our total cases, but we target it. So anyone who is any case that was related to travel or contact to a traveler, anywhere where we see outbreaks or a lot of transmission, then we target those samples for sequencing.
Thanks. And would you mind commenting on the Prime Minister's announcement regarding air travel today? Do you think this is a good way to combat the new COVID-19 variants that we've seen, and do you think more needs to be done?
I think it's a great step. The issue with international travel and sort of all travel, we've been messaging for quite some time. We're in a pandemic. This isn't a time for non-essential travel. We have businesses shut down. We have Manitobans severely affected by COVID. Right now, we need to focus on keeping these numbers down, preventing the importation of the virus and certainly the variants of concern. And then we can start focusing on getting things started again here, starting to open things up. The more people travel, the less likely we are to be able to do that.
From Global News, Joe.
Hi, Dr. Roussin. There's a lot of talk right now, especially in the United States, about double masking. What's the local recommendation here for double masking?
Right now at this point, we're not making that specific recommendation. We think masking is important. It's certainly mandatory indoor public places. We've given messaging before that mask should be at least 2-3 layers would be appropriate, and that's our messaging right now. So I think it's the fundamentals are what are important. So we want to limit the amount of contacts we have. We want to be washing our hands, wearing a mask, indoor public places, and then most importantly, more important than any of those, is stay home when you're sick, and that's going to help us move things forward here.
Thanks. If a new variant is found, would that change masking recommendations?
We got to keep this variant out to whatever degree we can, and that's what a lot of our steps are taking right now. And so, right now the evidence shows that if that variant is much more infectious, and modeling demonstrates that if that virus took a foothold, then we would see increasing cases. So we would have to rethink our public health measures at that point.
And just on the new travel restrictions, are there any plans to start keeping track of who's coming into the province and who needs to be self-isolating for 14 days?
Along with many aspects of our public health orders, enforcement of every situation is very difficult. And so we've continually messaged to Manitobans the importance of this. They certainly are enforceable. Anyone entering Manitoba, with the exception of those who have exemptions that are listed there, are required to isolate 14 days. So they would be subject to fines. And we'll continue to look at ways to ensure people are following that, because it's right now, as our numbers are tracking down through most of the province, we're at risk of importation of the virus, and then also at risk of importing any of those variants of concern. So right now, this is paramount if we want to keep moving forward with our reopening plans.
From the Brandon Sun, Michelle.
Good afternoon. My first question has to do with a local teacher who has to accompany a parent to Regina for an eye procedure because the parent isn't allowed to drive after it's done. The teachers did call Shared Health, asking if it was allowed, and they were told no. Why aren't there exemptions or new orders for taking people out of province for medical treatment?
So this goes back to my point on it's very difficult to have orders that address every possible eventuality. And so certainly emergency medical procedures and medical procedures people can attend to. The spirit of the order is to, reduce the risk of Manitobans. Every additional Manitoban that goes, leaves the province and then returns, there's a small amount of risk with each addition. And so in specific situations like that, there is no enumerated exemption for it, but we can review things. But again, it's very difficult to write an order that applies to every possible eventuality. The spirit of the orders is to reduce non-essential travel, to limit the amount of people that go, and then of course there may be certain examples that people can bring up that don't fit directly into our orders. But we have to write orders for the population as a whole.
Got it. Thanks. Second question. So, it's fine to say that we don't want to be where we were in November times. We're all of the same mind, I think. But readers, the public, small businesses, increasingly are saying it's time for data made public that actually demonstrates that small local businesses cannot operate safely. What do I need to do to get that information, going back to the beginning, that data that would show that it's too risky to open small businesses?
So for this is a number of ways to look at it. One is that we know how this virus is spread. This virus is spread when people interact, and the more interaction people have, the more spread of it. And so we were here before, right? We were here in October and November and saw that trending up. With the restrictions, we're in a much better place. So that's the evidence that these restrictions work. And it didn't just occur here, it occurred throughout the nation and throughout the world. Where you see the restrictions in place, case numbers go down. Here, it's difficult to have specific acquisition events and list this percentage was definitely acquired in this setting, because at one point, half of our cases were community-based transmission. We didn't know where they were. What we do know is that the more people interact, the more likely we're going to see transmission. So when we have these orders that limit the need for people to travel outside their homes, it's the surest way to limit interaction. And we see the benefits in our numbers right now. There's numerous studies in the literature on spreading at these high-risk settings that are closed right now. But in saying that, we always want to take that least restrictive approach. Our numbers are trending properly now. We have to keep our efforts up to keep them down. We have to keep virus from being imported into Manitoba. But with that said, we really do hope to be able to move forward with further loosening.
Okay, thanks. Regarding the FastPass pilot, is it looking good? Does it look like Brandon will be seeing such a site in the near future?
I can't comment specifically on Brandon. I think this site is operating quite well, getting very good results, a lot of good feedback. I think that what we saw was, and probably just because of our decreasing numbers of cases, we just saw limited demand on the site. And so that's why we've continually been able to expand the eligibility criteria. So I think it's working out quite well. I don't know about further sites opening.
Okay, thanks.
From CJOB, Merrick.
The announcement that Moderna is also delaying shipments in addition to Pfizer, does this change any plans for our distribution?
Yeah, thanks for that question. So we also were made aware of potential disruptions to Moderna this morning. Our planning team is looking at the information. We haven't received exact numbers as far as how Manitoba is going to be impacted, but our planning team is, right now as we speak, working on that to try to determine how this may impact our plans. So, I'm giving you the most up-to-date information that I have right now, but certainly as soon as we know more about what the numbers are, we will share with Manitobans how things may change.
And also with Dr. Roussin, with the 4 airports or 4 cities being announced this morning that international travelers would have to go to, just wondering, when Manitobans are catching a connecting flight at one of those places, will they have to isolate twice, 2 separate times, or will it just be the once for coming back to Manitoba?
We have to isolate for a total of 14 days after entering the country. And so most people will be isolated for 3 days upon arrival. If they receive a negative test, they'll be allowed to move on to their final destination, but they'll need to self-isolate for 14 days in total.
Awesome. That's it for me. Thank you.
From the Winnipeg Sun, Scott.
Hi, Scott Bill, Winnipeg Sun here. Dr. Reimer, the Moderna shortage, and I know you don't have a lot right now, but do you know if that impacts second doses for First Nations members? I mean, we don't have a ton of information on how those are being distributed amongst the First Nations, but would a potential shortage also impact then second doses?
Yeah, thank you for that question. As I said, we don't have a lot of details about what to expect from Moderna. They just notified us this morning that there may be a disruption. So a lot is very dependent on the numbers. It's obviously very disappointing to hear that in addition to Pfizer, Moderna is experiencing some disruptions, but this is what we're ready for. We know that vaccine supply chains are unpredictable. They're unpredictable in the best of times, let alone in a global pandemic. So, our teams have planned for these disruptions, and once we have better numbers, we will be able to analyze that. We're using Moderna for our personal care homes outside of Winnipeg, for First Nations communities, for Thompson, the Paw, and Flin Flon, as well as the plan is to use them for the additional congregate living facilities that I just mentioned in my first notes. So some of those will certainly be affected, but I don't know yet when to expect the disruptions to happen, nor how many. And we will have to work together with our First Nations partners to determine the best way forward once we have those numbers.
All right, thank you for that. Dr. Roussin, Dr. Atwell yesterday deemed curlers heading to the bubble in Calgary next month as non-essential, essentially saying that they would have to self-isolate upon their return to the province, assuming that's still in place in the middle of March. Would that be the case? And if so, why NHLers are allowed to travel around the country into the province, and curlers are going to be in a bubble scenario in Calgary? Why would they have to self-isolate upon return?
And so right now it's really just how our orders read, and this gets back to, we can't create our orders with every possible scenario. And so right now, there isn't an exemption that's listed for that specific scenario. And so we can always review it as time comes on, but the more exemptions we have, the more people who will try to fit into those exemptions, the more porous our orders are, the more likely we can see importation. So right now, there isn't a specific exemption that would exempt those people. It does sound low risk in that scenario, so we'll have to review it over time. But right now, we didn't write our orders to include that.
Okay, thanks for that. And my final question is, I just wanted to be clear on this non-essential travel recommendation. Obviously, that extends to all Manitobans. I just want to ensure that that also extends to politicians and perhaps certain leaders within the Winnipeg Regional Health Authority.
So the section that lists the critical care or critical workers, which includes the people you outlined there, that was always sort of a standalone exemption. It was always implied that if you were traveling for essential purposes, we wanted these people exempt to return because we didn't want to have undue burden on, say, our healthcare system or frontline workers or any other areas that we deemed. We've clarified that in this set of orders that if any of those individuals travel for non-essential purposes, then they vitiate that exemption in that scenario. So people who travel for work purposes, for essential purposes that are listed there will still have that exemption. We'll still want them to take the precautions necessary. But say somebody in that group of people travel for non-essential reasons, then no, they're no longer exempt when they return. They'll need to self-isolate.
Thank you.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. The numbers, especially in Winnipeg, are creeping down pretty well right now. And I don't want to get ahead of ourselves, but do you anticipate that Winnipeg and the province can aim to get under that 3% test positivity rate?
Well, it's our goal. Our goal is to bring down case numbers as far as we can, bring down that test positivity. And we're certainly trending in that direction in most of the province. We know there's, some concerning issues up north that a lot of people are working on, a lot of collaboration there. But I think the goal is to bring those numbers down, to now do whatever we can to decrease the likelihood of importing the virus further as our numbers go down. And then really to try to get things moving again here. That's always the goal, to take that least restrictive means. We've had these restrictions on for, many, many weeks. They've been difficult, but, it's clear what the benefit is if you compare to where we are now than to November. So I think it's setting us up to continue our progress.
It's been just about a couple of weeks since kids are back in school. Are you seeing any increase in cases related to school-aged children?
So we're not seeing increase in those certain cohorts. We're not seeing a increase in transmission within schools. We're sticking with our previous pattern that we certainly see cases in school-aged children, but we're not seeing a lot of transmission within schools. Where we see those cases in school-aged children, they're happening in areas where we're seeing a lot of community transmission.
Finally, just to clarify again on the traveling restrictions announced by the Prime Minister this morning, what kind of impact will it have on measures in place in Manitoba? Say, when you come into Canada, you'll have to be tested, quarantined 3 days in a hotel. Does that get rid of the need to get a test upon arrival in Manitoba? Sort of, if you want to just clarify what it will be like at that point when you arrive in Manitoba.
Yeah, so I think these measures really strengthen Manitoban's protection of importing this virus. So definitely, support these measures. So you're right. We've just heard of these measures today, so we'll have to look back at our messaging. It's not going to change any of our orders. So you're right. If somebody is they're now traveling internationally, you're going to be required to take a pre-departure test. That'll be negative. You'll land in Canada at one of the 4 major airports and isolate 3 days pending another negative test. Then you could travel back to Manitoba. So yeah, so we wouldn't really see a need to have a test again right when you arrive in Manitoba, but you are required to have a test at day 10 and required to complete a 14-day isolation in total. And so I think these measures just strengthen our ability to keep the virus out of Manitoba.
From CBC Manitoba, Bart.
Hi there. First of all, Dr. Roussin, in addition to the isolation order that was published yesterday, a new public health order went up last night that replaced the one on the 21st. I looked it over. Nothing jumped out on me. What language or specifics were changed in the one you posted January 28th versus the one in 21st?
Yeah, you know what? It was a very small omission that we didn't change. So, in the updated orders, we expanded the attendance at funerals to 10, and so that was in the main part of the order. What we didn't correct was in Schedule A, where we list funeral homes. It still read maximum of 5 there. So somebody flagged that, so we went back and just ensured that was at 10.
All right. Thank you for that nerdy question. I apologize for that. For Dr. Reimer, in your statement today and the numbers that you're providing, the press release today, of the completed first doses, Manitoba has fully immunized 0.43% of the population. The dashboard has been saying 0.6. What is that an error, or are you calculating that differently?
You know, the numbers I have in front of me are the ones that are in the bulletin, so I'll have to take that question away and review it with some of our logistics and planning folks and get you an answer to clarify that.
All right. My third question is for Dr. Roussin. I know you spent a lot of time crafting the nature of your messages to make sure that they are as clear to the public and that you don't get what you have called pandemic fatigue. How much damage has been wrought to your ability to message by this government's refusal to effectively punish people who don't listen to their advice?
You know, I think it's a real challenging thing, Bart, because there's issues on both sides, right? So we have, messaging in public health is very important, and to get that messaging out in a manner that people understand and can comply with. Enforcement, there's lots of issues surrounding equity, and then there's a lot of issues surrounding just on the ultimate effect of that enforcement. So I think enforcement is definitely necessary, but if we look at, say, contact tracing, if we determine a case and they tell us that they were at a large party, name all those contacts and we can go find those contacts and get them in isolation, that's a good thing. Many might question, well, why don't you find that person? They were at a party and they're not allowed to. Because if we find them, perhaps the next person who is at a party doesn't tell us about that party and we can't get those people isolated. So there's a lot of inner workings with it. I certainly hear from Manitobans that because the vast majority of Manitobans have always followed our advice. They're doing what they can to limit the spread of this vaccine. So to hear about people who have put others at risk. They hear about people that are, really putting our economy at risk. We're really trying to get things moving here. And like I said, we haven't learned a lot new about this virus recently. We know how it spread. And if those fundamentals are followed, if the orders are followed, we're going to see diminished transmission. So even in today's numbers, we've had a number of cases related to large gatherings, cases related to things related to funerals. And so again, understandable, but preventable. And when we see numbers like this, then it's putting us at risk, but it's also compromising our ability to move forward with the economy, because we want to move things forward.
Yeah, I should have said that. I was speaking about Tietzema and McLaughlin and the gentleman from the WRHA, but forgive me, I didn't make it clear.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. High numbers again today in the Northern Health Region, 81 cases per capita. That's about the same as 800 in Winnipeg. Can you tell us, are there big outbreaks in the north? Is there something that's developed in the last few days on top of the previous high numbers?
So we see much the same transmission. So there are outbreaks in some First Nation communities. There's outbreaks or a number of cases in Thompson. And so we're seeing that, a lot of contacts turning cases. We're seeing a lot of community transmission. And so there's a lot of work being done with the fundamental approaches to outbreak investigation, right? Case identification, a lot of testing being done, a lot of isolation. And we just know, and that's why we had the northern travel restrictions in place. A lot of planning went in, is because once that virus is introduced into sometimes these remote isolated settings, then we're going to see a lot of transmission, and that's what we're seeing eventualize right now. So a lot of work being done to try to get those numbers down.
And at this point, do you see it leveling off, or are we still at risk of these numbers increasing in coming days?
Well, we can still, we're likely to still see the numbers be increasing over time, but and it varies. So the communities are at different stages. There's some communities that, public health measures have been put in place, and we're seeing good results from that. Others are at earlier stages of the outbreak. So we're likely going to continue to see numbers increase in those areas, but a lot of work's being done to limit the impact.
Okay, and previously you've rejected my request to give a test positivity rate for the Northern Health Region, saying it's there's a small population. But I'm wondering, previously you've given the test positivity rate for Steinbach when the numbers were very high there. So can we get the test positivity rate for the Northern Health Region with the caveat that it's a small denominator?
Yeah, so I know earlier in the week I saw numbers around 26% for the Northern Health Region, and so that, like I mentioned, because we see fluctuation of the cases and the amount of tests being done, that fluctuates quite a bit. But earlier in the week I saw numbers around 26%.
From CTV Winnipeg, Michelle.
Hi, this question's for Dr. Reimer. A poll from Angus Reid came out today, and it shows like 39% of Manitobans are confident in the province's ability to distribute vaccine. 57 say they're not confident, 57%. What would you say to these people that are skeptic about our province's ability to roll out the vaccine?
I think we have a great team here. If we look at the fact that we're second in the country for getting Manitobans fully immunized, that really points to how effective this rollout plan has been. I've been continually impressed by our planning team, by the logistics team, by the public health nurses who designed and implemented the initial sites. And there's going to be a variety of polls. I know there was a poll the week before that showed that 70-some% of Manitobans were confident in the government. So we need to be really cautious using those numbers to interpret how Manitobans are feeling. And instead, we want to make sure that we're reaching out to Manitobans. So we have our town hall on Tuesday. And we want to hear from Manitobans, whether it's through the town hall or other mechanisms, so that we can make sure that they have the information they need to make informed decisions, so that they know how we're making the decisions that we are. And so I would encourage Manitobans to go on our website, to follow me on Twitter, to attend things like the town hall, so that we can continue to improve the understanding and engagement with all Manitobans.
Okay, my next question is for Dr. Roussin. With more businesses reopening, I'm wondering if the province is considering any changes to control and track the spread of COVID-19.
Will you publicly name businesses or workplaces with cases? And what are the pros and cons of doing something like that?
Yeah, and so we've always named locations where cases are where we think the public has been could have been exposed, where we can't effectively contact trace. So we'll continue to do that. If there's a high risk setting where exposure could have occurred, we'll definitely be doing that. We record where we feel the acquisition could have occurred. But remember that when we're talking about a fairly high amount of community-based transmission, right now about a third, and it had been higher, is by definition, we can't link them to a known case. And so we go back and look at places that they had been, and then provide a non-mutually exclusive list. Where they'd been in the last 2 weeks, right? Because we know the incubation period is 2 to 14 days for this. So when you're trying to look back at where someone actually acquired it, you're listing all the places they had been in the 14 days prior to onset of symptoms. So it's really challenging to have a detailed list. But most definitely, if we think there's a concerning exposure, we'll be naming where that is.
I also wanted to ask Dr. Reimer about doses per vial. Is Manitoba doing 6 doses per vial consistently? And how do we make sure that we get 6 doses out of every vial?
So Pfizer initially said that their doses were that their vials contained 5 doses. In Manitoba, when we use the smaller syringes, the 1 milliliter syringes, we've fairly consistently been able to get a 6th dose out of those vials. And that's really allowed us to extend the amount of eligible Manitobans who can come to our clinics. So that's been very encouraging. Pfizer's now considering changing some of their official information to indicate that it's a 6-dose vial. And I know some other jurisdictions are not having that same consistency, so this is leading to some challenges and difficulty for planning for other jurisdictions. We also know that there's a global shortage in those 1 milliliter syringes. And if we do go to a larger syringe, the ability to be so technically specific gets much more difficult. And it will be less likely that we'll be able to get 6 doses from a vial if we're using a larger syringe. So the federal government has told us that they have millions of the smaller syringes coming. And as long as we can get those smaller syringes, we should be able to continue getting 6 doses from the Pfizer vials going forward.
Our final reporter this afternoon with his trio of questions from City News, Jonas.
Good afternoon, doctors. Dr. Reimer, these next 24 hours are going to be a very welcome one, I think, for a lot of families with folks in personal care homes. Can we just elaborate a little bit about the protection these folks have now received against COVID-19, what this will mean to their health outcomes moving forward?
Yeah, so I wasn't exaggerating when I talked about the staff and the cheers and applause that they had every time somebody received a vaccine. It was really overwhelming because everyone was so genuinely excited. The residents, the staff, and the families, I'm sure as well, would be applauding from afar. So this first dose is only the beginning. It's really important that we also get that second dose to personal care home residents. Officially from Pfizer, they're telling us that the first dose, has a 50 to 60% effectiveness. There have been some other individuals who have done analyses of the data that Pfizer has shared and found that it might be significantly higher than that. So it's tough for us to know exactly how protected our residents are after one dose. And that's why we want that second dose going in right away. But even if it were 50%, that's still 50%. That still means that, if that virus were to show up with a staff member, with a visitor in that facility, that it's just that much less likely to cause an outbreak. So, this is exciting for the families, for the residents themselves, to know that compared to where they were a couple weeks ago, they're far more protected today, and things are only going to get better.
As a follow-up, Dr. Reimer, for folks that that have folks that are waiting to get into personal care homes and other concerning settings. They are going to be in the next couple weeks as well. That rollout will continue.
So because of the new information about Moderna, it's tricky for me to give any dates because I don't know yet when or how much to expect as far as the supply disruption. So going on what I knew yesterday, the intent was absolutely to go to other high-risk settings, which includes individuals who are in hospitals for long periods of time, in particular those who are waiting to go to personal care homes. If we end up with doses, and certainly there's no indication that we won't get any doses, it just sounds like it'll be a reduction, then we will continue to move to those other settings. And with whatever supply we have, we will continue to move from facility to facility as supply comes in, and our teams will be ready to go with whatever amount we have available.
Thank you for that. And just as a follow-on here today, Thompson open up next week with the cases in the north, kind of jumping. Just wondering for priority up there, who will be getting them first of all when the doses do arrive in Thompson?
So for Thompson, the eligibility is the same as the rest of the province. The goal there was to reach people who live far away from Winnipeg or Brandon, where it's not reasonable to expect them to come to the other two super sites. So healthcare workers are the primary target for Thompson, the Pas, and Flin Flon. But of course, going forward, when we have more supply, we will be expanding in the north like we are for the rest of the province as well.
And this concludes today's media briefing. Thank you.
Thanks.